Alrighty. Thanks everyone who's joined us today for the Medicare Minute. Today's topic is for July 2023. Our Medicare Minute is about Medicare and transportation services. So this is something we do get quite a few helpline calls about and questions about in general. So we will be getting into this topic today. But first, just our general housekeeping, especially for new people who are joining. This presentation is created and hosted by the Medicare Rights Center. Myself and my colleague Shay, who is on our call today, we are both senior education associates at the Medicare Rights Center, and we are a national nonprofit consumer service organization that works to ensure access to affordable healthcare for older adults and people with disabilities through counseling and advocacy. So through our helpline, we'll have that number up later. That's where we provide free counseling over the phone for people with Medicare questions. Also, we have educational programs. So we do a lot of presentations in person in New York City and many online, trainings for professionals, presentations for beneficiaries. And we also have our public policy initiatives where we have our lawyers who work in DC to protect and strengthen the Medicare program. So first, some technical housekeeping or background. If you have any questions today, please use the Q&A function to ask those questions. If you hover your mouse near the bottom of the webinar window, you should see this button for Q&A. And when you click it, it should either open a new window or at the side of your screen, and then you can enter your question in the text box at the bottom and press send. Once Shay has answered your question, the response should look like this. And just wanted to emphasize, please ask your questions in the Q&A function. I've noticed that the chat doesn't save everyone's questions. So if you're putting questions in the chat, we might not even get to those to put in the Q&A right up after. So please put them in here, and Shay will do her best today to answer as many as possible. We'll also answer some live at the end of the presentation. And if you have any technical questions, please use the chat for that purpose. So if you had issues downloading the slide deck, if I freeze suddenly or you can't hear me, Shay will try to troubleshoot with you from there in the chat. And also for folks today who need subtitles, we should have a live transcript function available. So if you select the CC button, this window will open and you can select show subtitle to get the automatically generated subtitles of what I'm saying during this presentation. So as always, we have the slide deck available before the presentation. We usually upload this, about 24 hours or so before our presentation. So you can download that on Medicare Interactive's Medicare Minute page. You can do that right now or after this presentation. So you have access to all the information today. And also, in addition to the slide deck, we do have a write-up of frequently asked questions for each Medicare Minute. So including a lot of the questions that you ask and that we answer today during the call. And this was usually available within a week after. We're trying to do it by the Tuesday after this presentation, so it should be even sooner. If you go to the Medicare Minute page, you can scroll down and find the appropriate Medicare Minute you're looking for, and we have a year's worth of records for this information. All right, so now we can get started into the content of today's presentation. I will be covering quite a range of information today, so it will include emergency ambulance transportation, non-emergency ambulance transportation, air ambulance transportation, and other ways to get transportation help. Okay, so we'll get started with emergency ambulance transportation. Starting with defining, what does Medicare consider an emergency? So Medicare considers an emergency to be any situation when your health is in serious danger and you cannot be transported safely in another way. So in this context, that note about not being able to be transported safely in another way is important, a criteria to meet, for Medicare coverage of emergency ambulance transportation. And, your health should be in serious danger. And if it's an emergency, you can't, pre-schedule this or call for an ambulance when you're not in immediate danger. It must meet these rules to be considered an emergency. And then Medicare Part B will cover emergency ambulance services as long as you meet all of these requirements. So one, the ambulance must be medically necessary. What I just mentioned about, you have to have an ambulance to be transported safely. And the reason for your trip must be to receive or to return from receiving Medicare covered services. Also, you can only be transported to and from certain locations. So we'll have a chart shortly that explains what these locations are and how to meet those criteria. And the transportation supplier must meet Medicare's ambulance requirements. Okay, so now we'll go into detail about what those transportation locations are. So you do have to meet these coverage criteria for Medicare covered emergency ambulance transportation and non-emergency, but we'll get to that in a moment. So Medicare covers this in a way where it has to be within your service area. So I'll define what a service area is. The service area is a geographical area or a region that contains most of the patients served by a healthcare facility. So this could also be that if you're in a small town, but there is, say, like an urban hospital like 20 miles away, and that urban hospital also serves a lot of the people from your small town, that's still considered within your service area. And if your service area doesn't have a facility that can appropriately treat you or give you the care you need, in that case, Medicare can take you or can cover ambulance transportation to the nearest appropriate facility outside your service area. And this is only if you couldn't get the care you needed within your service area. They won't take you outside of the area if you just want to, say, see a certain doctor that you like better. It has to have some kind of medical reasoning behind it. So with that in mind, Medicare will cover transportation from your home or any other place where this need may arise, and they will take you to the nearest appropriate hospital or skilled nursing facility. That's also abbreviated SNF, or we just call it SNF. Medicare will also cover transportation from a hospital or SNF to your home if that hospital or SNF is the nearest appropriate facility. Medicare will also cover transportation from a SNF to the nearest medical provider if the SNF cannot provide you with necessary treatment and the cost of transport is less than bringing the treatment to and from you. And lastly, Medicare will cover transportation from your home to the nearest appropriate renal dialysis facility and back. So that's a reason, that would meet the medical necessity criteria. If, you need, it's like medically necessary for you to be in an ambulance to get to or from the nearest appropriate renal dialysis facility. If you have ESRD, then Medicare would cover that transportation. Okay, and now we'll talk about the costs with original Medicare. So after you've met the Part B deductible, then Part B would cover 80% of the Medicare approved amount for this transportation service. After that, the beneficiary is responsible for the 20%. If you have original Medicare and you also have the Medigap supplement plan that helps pay for some or all of the remaining cost sharing, that Medigap would then be billed. It would help pay some or all of that 20%. and then you would be responsible for what's left over. This is, again, only with original Medicare. If you have Medicare Advantage, then the costs will depend on the plan. So if you're enrolled in a Medicare Advantage plan and you're curious about how your plan would cover transportation services, what the costs would be, we recommend that you call your plan to ask. Oh, also one more note is that all ambulance companies that contract with Medicare are participating providers. So that just means that they should always accept Medicare's payment as payment in full. So they will always cover 80% and they cannot charge you more than that 20% that you're responsible for. Okay, next we'll talk about non-emergency transportation. So Medicare Part B covers non-emergency rides in very limited circumstances. So one criteria is if you are confined to your bed, then they would cover non-emergency rides. Confined to your bed is, this is like more than homebound. This is if you cannot get out of bed without help. If you can't walk, you can't even sit up in a wheelchair, that would mean that you're bedbound, and Medicare Part B could then cover non-emergency ambulance rides. Another scenario is if you need vital medical services during your trip that are only available in an ambulance. So, for example, if you need certain medications administered, or if you need monitoring of vital functions, and that has to be provided in an ambulance, then they will provide that for a non-emergency ambulance trip. And in addition to those meeting one of those criteria, your ride must also meet the other requirements for Medicare ambulance coverage, like we mentioned earlier. The transportation locations have to meet the criteria, and you have to be going to or from receiving Medicare covered services and so forth. Okay, I just want to emphasize one more thing, which is with these non-emergency ambulance transportation, we do get callers who hope to get help going to and from their doctor's appointments because they don't have public transportation, they can't drive their car, they don't have other means. Unfortunately, Medicare doesn't cover rides just for those scenarios. There has to be some kind of medical necessity reasoning behind it. And you have to meet some other criteria. Like here, Medicare may cover scheduled and regular non-emergency ambulance transportation. If you're bedbound or you need vital medical services along the way. In addition, your doctor must send the ambulance supplier a written order. And that written order has to explain the medical necessity of your case, why you have to go in an ambulance specifically. And it has to be dated no earlier than 60 days before your trip. In certain states, ambulance suppliers must also get prior authorization from original Medicare. So they, in that case, you may also be denied, but just know, as with other Medicare services, if you're denied, you can choose to appeal. I will also read the states where this does apply. So in Delaware, the District of Columbia, Maryland, New Jersey, North Carolina, Pennsylvania, South Carolina, Virginia, or West Virginia, these are the states where ambulance suppliers must also get prior authorization from original Medicare first before they can provide that service. All right, next we'll talk about air transportation. Sorry, I should mention one more thing actually. We might get this in questions later, but just know that we're only talking about ambulances today because ambulettes, which are the wheelchair accessible vans, those are not covered by Medicare for transportation. So just talking about ambulances today. And we'll also talk about air ambulances. Medicare Part B will cover transportation in an air ambulance in these scenarios. If a ground ambulance cannot get to where you are, or if there is a great distance to travel or another obstacle involved in getting you to the nearest appropriate facility. Also, there are different requirements for people in a rural area. So in that case, the healthcare provider, your doctor, medical professional, will determine if it's necessary due to time and slash or geographical factors that you would need an air ambulance because uh, of those restrictions. Okay, so that's all today for our general overview of Medicare's limited coverage of ambulance services, emergency, non-emergency, or air ambulances. Now we can definitely get into more questions or specific scenarios during the Q&A soon. But first, just want to add some other resources. Uh, if those criteria you don't meet them, um, just know that if you have Medicaid, Medicaid may cover transportation that Medicare doesn't. So, for example, Medicaid could cover rides to and from your doctors when necessary. However, every state has different rules about what necessary constitutes, as well as different rules around how to access transportation with Medicaid. So if you do qualify for Medicaid in your state, we recommend calling your state's Medicaid agency to ask about their rules. Also, some of you may be in Medicare Advantage plans, and Medicare Advantage plans, some of them may cover transportation as a supplemental benefit. So I have heard some helpline callers mention that their Advantage plan promises them a certain number of rides to and from their doctor's appointments, but make sure always to learn about the rules and restrictions on this benefit. Sometimes they offer transportation and you have to find out what the details are, what the limitations are, if they have any geographical limitations or limitations on the number of rides, if you need to get any prior authorization. These are all things to find out if you're interested in a Medicare Advantage plan's transportation benefit. And if neither of those apply to you, if you're just looking for more local resources, you can call a state-based resource. So one that we often refer people to is Elder Care. You could go to their website at eldercare.acl.gov. Their phone number is 800-677-1116. Also, we always recommend that people call their state health insurance assistance program, or SHIP for short. Their website is shiphelp.org, and their number is 877-839-2675. The SHIPs every state has these. They are similar to us in that they provide free, unbiased Medicare counseling over the phone. They're not affiliated with any insurance companies, nor are they a government entity. So they can be a good, unbiased, informative source of help. All right, so we'll just close with some action steps. After today's presentation, if you want to know more about transportation, you can contact Medicare or you can contact your SHIP with questions about coverage. Your SHIP can also help you appeal if Medicare denies coverage of your ambulance ride. So as I mentioned earlier, if you are denied coverage, you can always, you always have the right to appeal that. We also have appeals information and packets that we can provide if that's helpful. And you can go through all the levels of appeal to see if Medicare will cover your ambulance ride, providing you feel that it was medically necessary, you met the criteria, and that you would fit those requirements. Also, if you have a Medicare Advantage plan, you can call your plan to learn about its coverage rules and costs associated with transportation. And finally, you can learn more about your state's, I believe I should say Medicaid program, and other local resources to help with transportation needs. And as always, we have our resources at the end. This is our helpline number you can give us, the Medicare Rights Center, a call at 800-333-4114. We provide, very case-based, specific to your situation counseling. We can work with you, answer your questions about coverage, help you appeal denials, etc. And we also have Medicare Interactive, which is our free online resource with answers to Medicare questions in clear, simple language. Everything that we talked about today about transportation, that should be on Medicare Interactive, so you can also reference it after our presentation. And there is our Dear Marcy newsletter, which comes out bi-weekly via email, and it has answers to frequently asked Medicare questions. You can sign up on your Medicare Interactive profile, or Shay should be posting the link, or has already been posting the link for medicarerights.org/newsletters, which would allow you to sign up for this newsletter as well as our other newsletters. And as always, please let us know what you thought of our webinar today by visiting surveymonkey.com/r/Medicare-minute. Not just about today's webinar, but about topics you want to see, ways you think we can add on to or change up our presentations. We'd be happy to hear from you. And finally, next month, our next Medicare Minute will be about Medigaps. So that will be on Thursday, August 17th, always at 3 p.m. Eastern Standard Time. This should be pretty useful and timely information if you're thinking about getting supplemental coverage, if you have original Medicare, or if you're thinking about switching into original Medicare to get a Medigap. You can learn all about enrollment and coverage and costs next month. And that is all for today's presentation. Thank you everyone so much for your attention. I'm going to bring this back to our helpline slide. So we have it up if you want to give us a call and ask about your own case or specific questions. And we also have a few minutes at the end for any questions live. So Shay has been answering in the chat or in the Q&A. And Shay, if you want to ask any live now, we can try to answer them.
Yeah, we've gotten a lot of great questions, a lot just in the last couple minutes, so I won't be able to get to everyone's questions. But let's start with one, Patricia. Someone asked if Medicare covers transportation to and from dialysis treatment under any circumstances.
Sure, yeah. That is a transportation location in the criteria to and from a renal dialysis facility, but you would still have to meet the other requirements, including, one moment, let me see if I can get back to that slide. From the beginning, I believe you would have to need vital medical services during your trip that are only available in an ambulance. If you want to get transportation to or from a renal dialysis facility in a non-emergency context. Or you could be bedbound as well, but it couldn't just be because you need a ride. There would have to be some kind of medical reasoning behind it, and the other related criteria about the ambulance supplier.
Definitely. This is one of the more common circumstances I hear about with scheduled and regular ambulance rides. So this is probably the most common example I hear is people needing help getting to a dialysis facility if other kinds of transportation could endanger their health. So if you're in that situation or you know someone in that situation, they should be working with their doctor to get in order for that transportation. Another question we got is if and how ambulance coverage would differ between original Medicare and Medicare Advantage.
Yeah, definitely. So Medicare Advantage, just in general, not just for these services, should always cover the same services that original Medicare does. So in this situation, they would have the same criteria for covering this, whether emergency or non-emergency ambulance transportation. The main difference is that with Medicare Advantage, the plans can also offer supplemental benefits. So Medicare Advantage plans have the right to offer transportation for non-medical reasons. You know what I mean? Like that they can just give you a certain number of rides if you need help getting to the doctor because you don't have a car. And they would have their own rules and restrictions around that.
Great, thanks. We're also getting a few questions about whether someone could get ambulance coverage if they have a specific like medical condition or a specific medical need. I think this is in reference to non-emergency transportation. If you need oxygen per se, Joan, I see your questions in the Q&A. If you need oxygen and it's an emergency, your ambulance should be covered because it's an emergency. Now, if it's not emergency and you need oxygen, I'm not sure off the top of my head if this would count. This is something that someone should be like working with their doctor, since it's the doctor who's determining if the ambulance is medically necessary. That sounds like a good reason, but again, I'm not a doctor, so I don't want to give a set answer on that. Let's see. Patricia, if you see any others in the chats, I'm just scrolling now to look at the newer ones coming in.
I did see someone mention, losing their driver's license soon. How can they get to the doctor for appointments? In these cases, if you don't meet those medical criteria for needing transportation by ambulance, then this would be a situation to consider, if you qualify for Medicaid, to see if that would be an option. If you don't qualify for Medicaid, you can also contact the local resources that we mentioned here, whether elder care or your SHIP, to ask about other resources in your state. I believe in New York, we have certain ones. Am I thinking about Accessoride? Sorry, I can't name them off the top of my head, but I do believe that states can provide certain resources for elderly folks who need help getting to their doctor's appointments. You would just have to find out about them for your location.
I'm also seeing in the chat someone asking about our next webinar. So I just want to remind everyone real fast, it's always on the third Thursday of the month at 3 to 3:30. And the Zoom link, I believe, stays the same. Is that right, Patricia?
Yes, the Zoom link stays the same every month, and you should see it on the Medicare Minute page every month.
Great. Okay, I'm seeing a couple more questions. Someone had asked, so Medicare Advantage can sometimes offer additional transportation as a supplemental benefit. Someone asked, is this only the case if you're a dual eligible, meaning you're also eligible for Medicaid? That's a really good point. So if you're eligible for both Medicare and Medicaid, you can enroll in some Medicare Advantage plans that include both your Medicare and your Medicaid. These are kind of dual plans. Those will definitely have additional transportation because Medicaid covers more transportation than Medicare does, usually depending on your state. But you might be eligible for additional transportation even if you just have like a straight Medicare Advantage plan, no Medicaid. Some plans will offer this as a supplemental benefit. So you don't necessarily have to be dually eligible to qualify for that coverage. It just depends on your specific plan. All right, maybe one more question. I see a couple about, I'm seeing someone say in a rural area, sometimes you'll get into an ambulance and they will ask you which hospital you want to be taken to and how are you supposed to know which one. That's interesting. I haven't heard that, just because I would imagine like in an emergency, you just want to go to the nearest one, but maybe in some rural areas, maybe there are a few options. I think to be safe, just go to the nearest appropriate facility to get Medicare coverage. They should know that. So I think in that situation, you should just say the closest one that can help me. Patricia, have you heard this come up on the helpline ever, or have any thoughts about that?
I'm sorry, I have not heard that on the helpline before. I would imagine, I would say the same thing as you, Shay.
I know, I feel like I'd be so overwhelmed. You're like in an emergency situation, they're asking you questions. Yes. Okay. We're getting a message from Nancy, another Medicare counselor, saying, just take me to the nearest facility that can treat my condition. Love it. Great. Well, that's all from me, Patricia.
Great, thank you so much. And thanks everyone for your questions. Look out for that Q&A write-up that will be available early next week, it should be, if your question wasn't answered. And if you have more specific questions about, your situation or how to get help, please call our helpline at 800-333-4114. And we will see you next month. I'll put it back up here again, August 17th, for our presentation about Medigap's. Until then, take care, and we'll see you next month.